Okay, let's go ahead and get started on our panel discussion, our first one here this morning. First off, my apologies. I failed to introduce myself this morning, and so there's a speaking head up here where many of you may not even know who the heck he is. My apologies. I am Paul Klain. I am the president of the Heart of America HIMSS chapter here in the Kansas City metro area. I'm also the vice president of physician systems for HCA's Midwest Health System here in Kansas City. And I've been a member of HIMSS since 1996, involved with the Austin, Texas chapter of HIMSS, and then when I moved here in 2006 and shortly thereafter became involved with the chapter here. We've grown our chapter quite a bit since then. I think we had around 120 members around that time, and now we're well up over 460 members and continuing to grow. Today, we have 125 or 26 registered folks who registered online. This is a free event paid for by membership. Fortunately and unfortunately, there was only 45 of the people who had signed up for this event who are actually members of HIMSS. So the rest of you who are not members of HIMSS, I certainly hope you see this as a valuable organization, and hope to see you afterwards enjoying our chapter, either at chapter level or as a national member with a free chapter membership. We certainly could use your help and support so that we continue to provide these educational events for you. So without further ado, I'd go ahead and start with our panel introductions here on the evolving health of IT roles and how Johnson County Community College's programs and health IT education can help support some of this environment as Julie had described and how it's evolving. But first, some bios, if we would, please. The first person I'm going to talk about on our panel is Adam Jones, Vice President of Creative Services for RareWire. He is responsible for the implementation of over 70 client mobile initiatives in iOS and Android. RareWire has created over 170 apps during the company's first 3 years. That's a lot of programming. Adam oversees strategy as well as leading the roadmap for RareWire's, app creation studio. Prior to RareWire, I'm going to get tongue twisted on this. RareWire, Adam was the first employee of PatientBuilder.com, a patient education and marketing platform for physicians, serving as the operations and development manager. He has also had roles at Cerner Corporation. Oh gosh, CMIO. How do you pronounce it? CMIO. Technologies in a product development role. Adam serves as a mentor and advisory board member for the Johnson County Community College Web Development Program and enjoys teaching mobile development and designs at Kansas University. I've got purple. My daughter go to K-State. Sorry about that. Kaufman Labs and Lee Summit's CAPS program, as well as Wire KC. Our second panelist, Shawn Foley. Of course, the introductions and the slides are not on the same pages, but that's okay. Is the Director of Health Professions Educations for Cerner. In this role, Shawn manages learning solutions to advance healthcare workforces to improve the health and care of populations. Shawn manages Cerner's academic EHR platform, working collaboratively with hundreds of schools around the country, including JCC. This solution enables JCC and others to further elevate health services practices by providing simulated patient care experiences that include EHR to prepare students for the digital environments they are entering. Shawn has a doctorate of education from Pennsylvania State University and serves as a board member for the Tiger Initiative Foundation Education Committee at MU, and that's Meaningful Use or Missouri?
Actually, neither. The Tiger Initiative is different than the Tiger Institute, which you may know with University of Missouri. Tiger Initiative started out at HIMSS, but it's a group that's guiding education reform in healthcare information technology and healthcare in general.
Great, thanks for that clarification. Our next, well, Only have two on here, so I'll have to read these off. Jeffrey Hackman, Chief Medical Information Officer at Truman Medical Center. Jeffrey received his MD degree from UMKC, where he was a chief resident in emergency medicine and assistant professor of emergency medicine. He then took a position at Truman Medical Center as director of clinical operations in the Department of Emergency Medicine, and subsequently moved from associate to chief medical information officer. Jeffrey manages communications, transitions, and education between the clinical and IT areas of the hospital. Besides numerous publications and presentations at the national and local levels, Jeffrey has served as a resident and student research mentor committed to students' education and moving medicine forward through research. And then our final panelist is Kay Grasso. She is the Director of Informatics for the University of Kansas Hospital. She holds a bachelor's in nursing degree, practiced nursing in a variety of specialties for 13 years, then moved to IT in 1989 to implement a variety of applications and systems in a small hospital. In Kay's words, nurses were very new to IT projects then. So were we. Kay moved to Cerner in the mid-90s and helped lead integrated implementations, participated in an internal knowledge management effort, moved to product management, and designed several applications for the pediatric community, then back to implementations. Kay took her current position with the University of Kansas Hospital about 7 years ago, where she has been primarily responsible for the Epic implementation and support. Please give a round of applause for our panelists and thank them for joining us today. Okay, so again, we are being recorded. We really would like for this to be an interactive between the audience and the panelists. The microphones, if you would please use those for any questions that may come up. And I can start off with a lead question if actually, I'm sorry. What I would like to do is allow, starting with Kay and to move across, just to have them do a little brief intro besides their bio about what they're currently working on and how this event might help them support the workforce, healthcare workforce IT programs here at Johnson County and what they're looking for from the workforce for the future. Kay.
Good morning, everybody. Can you hear me? Okay. Currently, at the University of Kansas Hospital, I have responsibility for the application teams, both in the revenue cycle as well as the clinical side. And of course, we are actively working on a revenue cycle project as well as trying to keep up with meaningful use. And those are probably our two biggest efforts, although we're always working on optimizing and pleasing our end users and providers. So, and in light of that, we are always looking for more staff that can jump in and hit the ground running in these implementations. And that's why I support the program here at JCCC. So that's why I'm here and looking forward to the discussion.
Well, I would second everything Kay said. At Truman, we're doing many of the same things. I think hospitals across the country are focused on meaningful use, and many of us are doing revenue cycle projects as well. The other thing, and I think KU is also involved in this, is health information exchange among the community and region. So that's a big project for us right now. And then we are also working on integrating some of our our areas that are currently not part of our primary EMR into the main EMR. So we have a couple of niche systems still, and so that's a big focus right now. Similarly, we are always looking for talented people who either have, the technical skills, the clinical skills, both that we can put together or bring into the group to hit the ground running and work on these and many more projects.
RareWire, on top of building nearly 100 apps now in our first 3 years, our primary goal is a platform that allows web designers to build apps and not have to know hard languages like things alphabet soup, like Objective-C and Java, things that nobody wants to talk about. And so a lot of that initiative has been education. And so we've been going out speaking about just mobile development in general, but getting involved in the community. And so I'm involved here at the school, working with students who are building an app for called the Hemo tool, and allow hemophiliacs to track their where their bleed points are, get materials, all that good stuff. So, and I am not the only person that builds those apps. We have a team of 6 that do that. And so we have a large client base. We work with clients that are in the medical field, working with getting documents from the computer to the iPad and messing with all the security involved with that. And we have clients ranging from that to the Atlantic to Mitt Romney. Not the app that spelt America wrong, but we did help them out. So wide range of experience in that.
Shawn Foley, Cerner and the Tiger Initiative. At Cerner, most of my responsibility comes with helping our clients and then also outreach to education, so academic and business partnerships. And my team and I are trying to help prepare the future workforce for the digital technologies and environments that they're entering. And that's also what we're trying to do with the Tiger Initiative as well, is guide education reform through that preparation of that workforce. We have a lot of challenges ahead of us, and I think one of the ones that Cerner is facing is a good problem to have, is there is a lot of work to be done in the area of engineering and technology, and Adam has highlighted some of that, as the rest of my colleagues here. There's a shortage in engineering today, and technical degree programs and students going in to those fields. And so, I'm interested in why you're here as well, and what you're facing from your challenges, and how can we work on this opportunity together to really close this gap we're seeing in the United States, which is, and probably in the world, around engineering and technical roles, and how to really, I think, improve the human condition is what we're all trying to do.
Okay, so for the panelists, again, we're being recorded as well as those in the audience. If you could pull the microphone up a little closer just to make sure we can get you on the recording or in the streaming and everybody can hear you, that'd be great. So the first question I have for the panel, and we can start in any order. Anybody wants to jump in, that's great. We just heard the keynote speaker address the future of health IT. Whole lot of mobile and security concerns outside of the 4 walls of the hospital. How specifically is your organization preparing for the future of health IT in that environment? So maybe if we could start second in, that way we don't always hit the first person closest to me.
Sure, I'll tell you a little bit about what we're doing, and I'll also tell you that I'm going to steal one of the ideas that she mentioned. So we're doing a lot of community outreach right now, and obviously that involves some sort of non-traditional ideas in healthcare IT. And so we're doing some streaming video, we're doing a lot of web connections between the hospital and some of our outlying clinics. We're working with some churches, some homeless shelters, some places where patients, or what we consider patients, are able to get some of the care that they otherwise wouldn't get. And so the idea that I'm going to steal is barbershops. I had never thought of that. I think that's a great idea, because it's a place that a ton of people in our community go, and it's an opportunity to capture, blood pressure or just kind of general health. You can always look at somebody and say, oh, they don't look very good, maybe I should call their doctor. Anyway, so what we're doing, I would say over the last, constantly, but what I've seen over the last 10 years or so is a huge evolution in the roles that we need in healthcare IT. First of all, the Chief Medical Information Officer role didn't even exist in most places 10 years ago. So the fact that I have a job is new, at least for me, and in our organization. But the other thing is we're looking for, constantly looking for new skills that may not have even been in existence when people were going to school 5 or 10 years ago. So, there really wasn't a big need for people who were thinking about texting or video or VoIP, those kind of things. And nobody was learning those things in school 5 or 10 years ago. And now we have to not only think about how are we going to use them, but how are we going to use them in a safe way so that providers get what they need, the patients get what they need. And that's, I think, a struggle in a lot of places.
Yeah, I don't touch healthcare, I don't think, on a daily basis as much as the other three. But one of the genesis of the platform that we use every day to build our apps is to open up the marketplace of those that we're building apps. So that way the web designer can make money in the App Store. And it just opened up the pool even bigger and bigger. In fact, just 2 days ago, individual that has an account, not a company, an individual that has an account on our platform created an app for opening day. And he got lucky and got a very prominent blogger to mention it. And it shot to #1 in the sports section for paid and broke the top 100 in the entire App Store. And he is just a web designer. He can code some HTML and CSS and does it okay. But that's, his day job is marketing and social media, actually at Cerner. So he's seen a lot of money come in the last few days from that. And it's purely because the technology is there to bring it down to his skill set. But we see that a lot, and even from a personal standpoint, a lot of the technology we offer up now is to make smarter consumers. And so just last week, I was doing an annual physical, which is always fun. And the doctor's sitting there, love my doctor, and we're sitting there, and she's just asking me a ton of questions, getting to know me again since the last year I was there. And she noticed this thing on my arm. It's an up band. Does anybody know what that is, by chance? Essentially, it tracks my step, how many calories I burn, how I sleep, deep sleep, not deep sleep, what is that called? And it keeps all that stuff. And I take this off and I plug it right into my phone and it captures all my data. It's available for Android now too. But it's a $100 device and I love it to death. I also have a 3-month-old, so my sleep is awful right now. And so I plugged that in and gave it to her, and she didn't have to listen to me tell her, like, oh yeah, sure, I get 6 hours of sleep tonight. I think I exercise okay. She literally started looking through every day, going, your sleep, you're not getting enough sleep. 6.5 hours is not enough. And so, I can't lie to the doctor just to try to get through that visit. She sees all my data right there. And so it's being able to allow individuals to make applications that can do that is what I see a great benefit for. Okay.
Absolutely, Adam. And Jeff made a good point as well. Julie talked this morning about behaviors and how do you get to the positive behaviors we're all looking for. Technology alone does very little for us if it's not used in the proper way. And that takes us, we're the users. And so when you think about developing technologies and empowering people and involving them in their health, that is extremely awesome concept. This band, I'm getting one. And so I think when, one of the things that we're looking for at Cerner are folks that understand technology, sure, but also understand people, understand how to change behavior. And that is not something that you're necessarily going to learn in 4 years of college or, whatever education you have. That's something that takes interaction. It takes experience, and there's not necessarily a time limit on it. So what I try to help folks who are entering the career world and before to understand is that get those experiences that are interacting with folks and are basically the people skills that you need, because those people skills are very hard to find, I think, sometimes. So that's one thing we'd be looking for.
Luckily, at KU, I don't have to deal with all of those technical pieces. My colleague, Shawn Roberts over there, addresses many of the issues that Julie brought up. But I think that the things that I'm trying to prepare for the future is much about the people helping get these applications up and running and in the hands of our users or our patients or, you know, lots of other people in the community. And we are looking at things like, do we do a lot of cross-training so that we don't have any one knowledge holder, but we look at the things that we are implementing and we say, you know, I can't put that in the hands of 120 people. I have to control it. So it's starting to try to develop, excuse me, those strategies on workforce planning and training, and you know, what are they getting out in the colleges, and then what do I need to deliver to them once they get into my hands.
Okay, thank you. Do we have any questions from the audience over here? Hang on, we'll get a microphone right to you. And if you would, when you do from the audience speak, if you would just introduce yourself and who you're with, that'd be great. Thank you.
Good morning. I'm Deb McFeeder with Vital Support Systems. My questions is this nirvana of the EMR move into an EHR, move into a patient healthcare record. In your view, who has the responsibility, motivation to build that? Obviously, within your system per se, great value in having the team that may be associated with the patient's health interacting and able to see and view each other's data. But when they move outside the system and the value of the data that may come from you know what streaming videos they've looked at around a potential diagnosis. So it gives you, you know, content that necessarily you may or may not control. And so obviously it costs a lot of money to put all this information somewhere. And, you know, what do you think is the right policy, philosophy, you know, adoption strategy that patients are looking for? Is that something they subscribe to? Is that something that you build for them and allow other people to append data to? Because all of the things from the individual, you know, personal health and fitness tools that people may use that are being built by people like Adam are a component. So I'd be curious your thought of how we move through this. Everybody's been just focused on the EMR. Now we're talking about extending it to the next step, and then one more step includes then maybe some consumer type content.
Well, I'll take a stab at it. I think it's a really complex question, and I think we're just taking baby steps in that. And, you know, in terms of who has a stake and who has an interest, I would say from what I'm seeing, we've got patients, providers, and vendors who are all interested in doing it, but none of us are doing it very well. And we have to figure that out, and we have to do it pretty quickly. So, you know, there are sort of the basic things. I mean, we've got a patient portal. We need to be able to enable it so patients can actually add information to that themselves manually. But, you know, we've seen Google and Microsoft had portals where you could pull in information from other systems, and that didn't really go very well. So we have to figure out a way to make that sustainable. Because if huge companies like that can't do it well, then how are we going to do it at a health system level? So we have to do that. Policy-wise, you know, that's a struggle, and you have to figure out how to make it meaningful to the patients so they're getting something out of it, because otherwise why would they contribute that information? But then also, if you're on the provider side, you know, I don't want to know every video my patients have looked at on YouTube. So how do you kind of consolidate that and say, here's here's the useful information to you. And I don't have answers to any of those, unfortunately. Hopefully somebody in the room does.
I think in some ways you're asking who's the owner of all of this. And I was talking to some folks from the state of Kansas not too long ago, and same question came up. And from my opinion, or for me as a patient, I think I own it. And what I'd like to do, if I had a lot of money and a lot of brainy people with me, is create banks and let the patient deposit their medical record in a bank, and then I tell them when to give it to somebody else. But I don't know if anybody's doing that. I think Cerner was talking about it one time, but.
So this is my view less than Cerner's view. I think that's important to maybe, I feel that this has got to be a person-controlled thing. And so we have to take control. Everybody in this room, everybody in our community needs to take control and be accountable to their health. And for a while, that's going to be kludgy, because you have so much noise, you have so much buzz, you have everybody trying to solve this problem with technology and apps and different things. So find out what works for you, and maybe a solution comes along. Maybe Google figures it out, maybe Cerner figures it out, maybe Epic figures it out, I don't know. But in the meantime, don't wait for that. Start to figure out, like your bank account, what's my health account? How do I manage my health and then help my provider manage my health? My doctor doesn't need to know everything I'm looking at on the internet. So what are the sources of information, kind of sources of truth, evidence, like this armband, that can give that doctor what they need to help me? And how do I interact in a collaborative way?
I'm not sure what I can add to this part. I think one of the great parts about the collaboration is it doesn't have to be so one-to-one. It doesn't have to be patient's device or computer in the hospital to some cloud environment. Apps are allowed to talk to other apps. We can share information around. So if an individual loves something about the up band, there's starting to become data that you can go access, get information, credential yourself in and say, create a secondary app because somebody else sees something very important about the data in the up band that they don't see right now, and they think there's something there for it. So they can go and make that complementary app and allow an individual to just sign into that account, pull that down, and so all of a sudden you have this chaining of apps. So you don't have to wait for everybody to make this powerhouse of a solution, is that we can kind of daisy chain things together, store information, pass it to the next one. That next one eventually might go to the cloud or some system that is distributed within the hospital. So it doesn't have to be just one-to-one.
Okay, do we have any other questions? Dan?
Dan Earler, the EHG group. The question I have is, since the panel is talking about the evolving health IT roles, I've been reading through a lot of what's going on with PACA and all of those initiatives, and also following very closely the last several years of the pay for information, pay for performance, eventually leading to pay for outcomes. That whole concept of outcomes and the emergence of ICD-10 with its plethora of codes, is leading me to question about evolving roles that are happening out there. There's this big push on, bring your own data, bring your own device, PHRs interacting, communicating. So the question is, with big data analytics and dashboards and those types of things evolving rather quickly, what do you see as stewards of information or technology and the value of that as we push for outcomes in 2020? What what do you see as some of the roles that you're putting in place or that you see that need to be put in place today, early, to get the education and the knowledge of the types of roles that you see are going to be emerging in healthcare? It's going to be more than just plain IT roles. There's going to be, I think, the convergence of devices, business strategy, and also participation. So what sort of roles do you see, and even maybe new departments that you see as evolving through the noise of all of this, healthcare clamor and what's happening?
I'll go first. We're seeing that again, I talked earlier about, do we specialize or do we do a lot of cross-training? But in some of those areas that you're talking about, I see that we need data stewards that are focused on what are we putting in the system as far as what the users use, our build, but also what are the users doing in the system. So are they working around those things that we put in the system to record the best data? Sometimes, and a lot of times, the users find ways to work around that and put in bad data, and that starts to develop into bad outcomes, or it can. The other thing that I've been exposed to recently is the legal side of it, and that the attorneys are now starting to look at the electronic medical record, or at least the attorneys I'm dealing with, this is new ground for them. And that's a whole nother world. It's pretty scary. And, as Julie was talking about texting, I wrote down the question, is that part of the legal medical record? And when are they going to start asking for records of not just phone calls in the hospital system, but also records of your cell phone? So there's that data steward of, are we building it right? And then are the users using it appropriately so that we have good outcomes and we don't have the legal issues that we could have? So that's just one small piece of it, and that probably breaks out into 3 or 4 different specialties alone, in my mind.
I think the other things that we've had to do, and you touched on it even in your question, are, we have people now who specialize in managing massive data sets that really, that's a fairly new thing. And within that, ferreting out the things that actually matter, and then when there are things that don't make sense. So actually, just as I was about to walk in the room, I noticed an email on my phone from someone saying, on this ongoing professional practice evaluation report, which is something every hospital is doing now, we have a physician who we know sees patients, but only has 12 documented visits in the last quarter. So now, fortunately, I have somebody who kind of focuses on ferreting out, where did we screw up? Is it the report? Is there some interface that's not working correctly? Whatever, to figure those kind of things out. And then, as you said, getting people to react and doing something with the data. In my experience, that, at least with clinicians, is often the easier part. So if I can give them good data that shows, here are your peers and you're, 2 standard deviations below them, they tend to be a pretty competitive bunch and make themselves the same as everybody else or better. So it's usually the struggle is getting them good data, and then they deal with it.
I think that 2 points is that one thing a lot of people tend to forget when like Google Glasses comes out or any of those things is that technology is supposed to make life better or easier, or is supposed to solve a problem. And so, and some of that is a lot of time in software development. What happens is developers specifically, and then stakeholders from a client perspective that are outside maybe the objective of the goal, is they start adding what we call feature bloat or scope creep. And they start just throwing all this stuff. It'd be really neat. Oh, what would be really neat? And And what you end up with is this application that one person knows how to use. And so what's really happened with mobile development is you have these platforms that are out there that look to go outside of just the Objective-C programmer or just the Java programmer and allow to bring more people in to play. And you know, one of the things that the iPhone got bashed on when it first came out was the fact that, you know, it didn't have multitasking, right? I can only have one app open at a time. Good. You're focused on what you're supposed to be doing at that time. And I think, you know, the more that you have individuals that can know and learn a system and the skill set's lowered down and it's a focused experience that it's here to achieve this goal. When I'm in email. I mean, get your email done and move on. So sometimes I think we want technology to be overcomplicated just because it's technology. But the Google Glasses, as silly as they look, and they look ridiculous, but they're trying to get everything up here and not down here anymore. And the only way that you can get stuff up here is one thing at a time. And so you can't tell Glass, you can't say, okay, Google Glass, give me stock ticker for this and the news and da-da, and then you're no vision. So, I mean, it's one piece of data point at a time. And I think we're slowly starting to learn, and Google themselves are starting to learn that that's not a bad thing. You know, lowering the expectation, the skill set needed, and the data that comes back is actually a brilliant thing.
Completely agree. So good data stewards, communication, making sure that information is getting to the right people at the right time so they can act on it, and focus, I think are three great things that the role, you know, if somebody wants to get into a data role, they should be thinking about. Data analytics. We're living in a world where we have hard sciences and we have social sciences. We're blending this technology, what would maybe typically be in a hard science setting, with the social. And everything's not quantitative. There's a qualitative element to the way that we review and improve as a society. We know that. So we know that intuition, creativity, imagination can drive innovation. We don't really know a lot about those things and what that means. We're starting to learn about brain science, about learning sciences, and how this all comes together. So you have your evidence and you have your intuition. So what I think we're all going to need is folks who are good with data analysis. And when they look at the evidence, whether it be intuitive, you know, surveys, perceptions, or evidence that's more hard, how do you bring that together and factor in all these variables and, you know, make sure you have your threats to internal and external validity, and your study is credible, and all that stuff we got to figure out, because we're going to have big data. We're going to want to take, we're going to have middle data. We're going to have local data that's actionable. So how do we get there? And I don't think we can get there unless we have folks who can analyze and interpret and infer the right stuff and then communicate it.
Okay. Any other questions? All right, so let's move on to another question. Again, focusing more health IT roles. How do you see health IT roles evolving to meet the future of health IT? And then what are the trends around those roles? Adam?
Yeah, I'll start where you left off. It's being able to analyze and perceive that data and what it means. So just because my phone's collecting data about what my day was like, I personally, this hasn't changed my life. I mean, I don't do things differently now because of it. I just think, it's cool. It tells me how I slept or how bad I slept last night. And I go on with my life. And the next night, guess what I'm doing? Same thing. So, you know, having those gateways for me to provide that to a physician, or for my physician, for her to look at it and say, this is what this means. This is why your back hurts, or I don't know, whatever. You're sitting too much, you're not walking enough, or, if this thing starts keeping track of my, pulse and all this other stuff, and then she infinitely has a better understanding of my body immediately and can tell me what I'm not perceiving. But that role within IT is just, I think it comes back to, there's a reason why everybody has Google Analytics on everything that they build, even from the website to the app. We put analytics in every app that we do. And so, initially, when we engage the client and we say, hey, we can put Google Analytics or Flurry or any analytic tracking stuff that they want in there. We can put that in your app. Like, great, we need that. What do you want to collect? What button they hit, it's what we get. So we put it over everything. And then when they start getting those reports back and they start analyzing it, we kind of help guide them. So it's learning how to make that analysis of the app itself. So all of a sudden, that little feature that the CEO wanted, and it's not getting clicked on, we can finally convince them that we don't need that. So I think app after app after app that we do, one of the strongest things that we can do is go back to them, say, here's your data for that usage. This is how it's being perceived. This is how people are using it. Ignore the Apple reviews, because those are just those are people that are upset that they spent 99 cents and it doesn't do what they wanted it to do. And the analytics speaks more to that. And so just having that person that's able to dissect that and build a smarter environment, whether that be consumer or physician facing, is a great place to be.
Anybody else?
Well, I think the other side of the analytics is also just understanding from an analyst role of, what does my user need? What are the requirements? Do I really, really understand? Not what they tell me they want, because many times, and I've been guilty of it too, I tell somebody what I want because I'm trying to solve the problem myself. So I want you to sort this way because I think that's what's going to solve my problem, instead of saying, this is my problem, how can you solve it? And I think that the analysts need to remember to understand what's the problem we're trying to solve, and not just listening to the end user to say, I want this sorted this way. I may sort it that way, and that may still not solve their problem. So that's something that I run across periodically, and I've been guilty of it myself, is we've got to understand and analyze what it is the user is trying to get to.
I think that's a really great point, and I think part of the evolution of these IT roles is becoming more of an internal consultant, which we kind of talk about a lot with our staff, and it's exactly that point. So when an end user comes to you and says, I want you to do this, historically, we just did it. And then, over the last couple of years, in change control and in between, we start talking about some of those things within our informatics group, and more, it's like, well, that's sort of a dumb thing to do. What are we really trying to fix when we do that? And I think now we're getting to much better solutions, because we've got a lot of people now who are thinking, okay, they're asking for this. What are we really trying to accomplish? And I think in the long run, we're making people happier. But that's a tough skill to learn, I think.
Mm-hmm. There's nothing that changes your opinion on how you develop your software for your user than iTunes reviews of your application. They're really, you start to realize when you first have an app and you put it out there, you want to appease every single person. And you soon start to realize that the only person that really tends to review an app is someone that's upset. But you start to realize that, this person's upset because they spent 99 cents and it doesn't support both orientations. So therefore, they're telling me that it's only worth 50 cents. And so people have become like really cheap in that sense, but you do start to realize that one person's upset about that. Yeah, and it's not cool that they gave me a 1-star or whatever, but at least you're able to go into the analytics and be able to look and see 2 people were upset yesterday, but in the case of Tyler's app that got featured, 2,000 other people downloaded it yesterday, and not one person felt the need to make that review. Generally, if you have that many downloads and you have a couple bad reviews and no good reviews, people like it. It's pretty hard. Usually it's friends and family and people that have some connection to you that will help out initially with the good reviews. And then as it starts rolling, you might start, or if your app, everybody's probably seen the app that says, hey, can you take a second to review the app for me? It's because we have to combat all the people that get upset about spending $1. So it does completely change your perspective on that whole conversation of, well, user A is complaining about this, so let's just make the change. And in normal software development, especially with web development, that's how it works. I mean, it's somebody doesn't like it, let's change this color from blue to red, and let's just do it, and you change it. And so now things are looked at a lot differently when it comes to mobile.
Absolutely. I think the way that the workforce is evolving, it's ambiguous. We're solving kind of these ambiguous, we have these challenges that are ambiguous to us. So I can't tell you what your role is going to be. It's as duties, other duties as assigned kind of thing. Generally, yeah, sure, I can give you the what or the how, but I really need folks who can solve complex problems. And what we were talking about here is assessment. So the complex problem of being able to assess people, whether they're writing a review or they're in front of you saying that I want this. If you're a consultant, and a highly valued one at that, you know how to listen, you know how to ask certain questions, and not just take orders. However, you also need to be able to assess that person. What are they really saying to you? And how can you build something that's going to improve their life? And then I think the last point you're making, we're all kind of making, is the bias, understanding the bias there. So I find that reviews are either negative, folks that don't really like this hotel or whatever, or really super positive, people that loved it. So I need to ask myself, in the writing, what are they really saying? And does it relate to me? So if I'm trying to use reviews to evaluate technology or a location or travel spot or food, restaurant, whatever, what is this person similar to me or not? And I remember one time I was traveling in Europe and I was staying at different places, and one person was really upset about this place that I stayed at because the breakfast was not a true Belgian breakfast. And the reason was because they thought that included a Belgian waffle. I'm like, so I had to understand that this person was upset because they didn't get their Belgian waffle. And actually that's not the way they eat breakfast in Belgium, so that's why I didn't include that. So.
Great. So just summarizing a little bit of what I'm hearing, and maybe to spark some additional conversation around this here, is it sounds like, as with Facebook or other apps, or I forgot what it was called for your wrist there, these are all things that are addressing behaviors rather than project or criteria about what you want to accomplish in terms of reporting or data collection. So what I'm beginning to hear from the panel, and for students in the audience and everyone else, is health IT needs to be evolving from a situation of meeting criteria that are defined at the beginning of something to, I now have to understand the behavior of my constituents and how that may evolve through the projects as well. And as a coder or somebody who's in a workforce redevelopment program, and we have people who are coming from an IT world that are not familiar with a behavioral-based industry like healthcare, that's a challenge. And so that leads me to my next question here is, what do you see as the greatest workforce challenges that each of your organizations are facing? And maybe, Kay, we could start with you.
Sure. Just short and sweet, enough people that get it. We've got to have people that can understand it. And there's always the debate, can a clinical person understand the technical world better than a technical person understanding the clinical world or the revenue cycle world? And in my experience, it depends on the person. So that's why I say it's those people that get it. It doesn't matter where they came from. Can they get it? So.
Yeah, that's so true. I mean, we've got excellent people who started out in the clinical world and learned the technical stuff. We've also got some amazing people who started with a technical background and, they don't have a clinical degree, but they've figured out what they need to know in the hospital or clinic setting to make it work. I think we are in a fairly interesting role here in Kansas City. My hospital has Cerner as a vendor. Cerner is based in Kansas City, and when fewer hospitals use Cerner in the city, it really helped us because we had all these people who worked at Cerner. They wanted to get off the road. They'd come work for us. Now that we have a lot of people, a lot of hospitals in the city who are using Cerner and in the region, it's a very, very competitive market, and so the highly talented person who can come in and they know applications and they can start on day one being productive, those are fewer and far between. So because they can demand the high price and the lifestyle that they want working either remotely or for a consulting company or for a different hospital, those kind of things. So the number of people is by far the number one challenge for us.
Yeah, and that's one thing. At RareWire, we try to practice what we preach, is that the platform that we're using is meant for web designers. So my mantra when I hire individuals for my team, I look for designers first because I can't teach taste. That's either you have it or you don't. You can modify some stuff, but I can teach wire or our language or any programming language all day long. I can teach that to someone. And so we hire designers, and within the first week or two, they're building apps that they're designing by themselves, and they're writing in our language logic that they would not be able to write in another language, and they don't realize that the business logic that they're writing when they do it. And so it is kind of knocking down that talent pool. We Objective-C programmers are they're not hard to find, but everybody wants them, and so they're very, very expensive right now. And so we hire those individuals to work on some of our platform stuff. But when it comes to my team, we need to make apps that look really good. So when we go to other prospects, they go, wow, that's a really good looking app. We want an app like that. So I need to hire the person that can make it look and make it sing, and then I can teach them the rest. And so it is really kind of that training and analysis of knocking down the barrier and not having them scared of learning something new.
So I'd like to turn this over to Brandy to answer this question about what Cerner needs the most. Brandy is from Talent Development and Cerner Careers, and she will be able to answer this very well.
Thanks, Shawn. So, I run a lot of the recruiting department at Cerner, and so what we see a shortage of in the war for talent today is really the technical, the engineers. So we're trying to hire approximately 500 software engineers in the United States and Kansas City mainly this year alone. To Adam's point, there are not that many out there, particularly in a lot of the languages we need them in, and in Java, now that we're getting into iPad, we need iOS developers. So the competition's fierce, so we're competing with all the big companies that are hiring lots of engineers. And it's kind of a scary time, because if you look at the trajectory, I think they say by the year 2018, I read an article recently, about there will be one programmer for every 3 jobs that exist. So that's why, to a lot of the points that have been made today, there's a lot of STEM outreach going on. We're trying to get involved in the community and trying to reach out to students when they're as young as in grade school and in middle school, and encourage them to go into those technical, engineering, and math types of fields. So definitely a shortage we're feeling today. To the other point, I think Kay said, people that just get it. We look for that too. We're hiring lots of consultants, so as Jeff mentioned also, there's a lot of consultants around that are familiar with implementing Cerner, Epic, other systems. And we do need people that get it, right? And as the workforce continues to evolve, and as where we need it to evolve, we need, I'd call them kind of high-value consultants. So as there's more hosted solutions and people are going to be doing implementations virtually, you have to have people that can handle change management in a different way than we've seen it in the past and currently. So I think that's where we see the needs going, and we do see a shortage, like I said, in the technical space, and the need to find more people that do get it. And making sure that, if there's curriculum that can align to what the industry needs, we're focused on that as well, to make sure there is that alignment and the supply and demand gets closer together. So.
Okay, questions? What, up front?
Hi, I'm Judy Guzzi. I'm an associate professor and technical services librarian here at Johnson County Community College. And currently libraries are spending 70% and increasing of their budget on electronic and digital resources. So I see many similarities between your issues and our issues relating to information technology and information management. I mean, just a few of them, I was just jotting them down: project management, privacy, mobile apps, system development, access, multiple constituent groups. So there's just a wide variety. And so I meet many new graduates from library and information schools. I think I see this as a wonderful fit for many of them to be moving into something like this with the skills and the information management skills they get. What would they need to be able to speak your language? Because in a way there are 2 different languages being spoken. So what would they need to cross that bridge? Because like I said, I meet many, and there are some who have great technical experience too. But what would they need for you guys? What would you look for? I mean, if you saw the word library school, you'd go, ugh. So what would they need to convince you?
Well, actually, I do need a librarian, and I have thought about that we need a change librarian or a test script librarian or a training curriculum librarian. So actually, if somebody came through the door, I might convince somebody that I hire a librarian. So that's certainly one. And if they're in the library, they could certainly look at a medical nomenclature book and start to learn just the medical language if they're going to be in the application side of it. I had colleagues that did that years ago. They'd come out of the laboratory and have to start working on a radiology system, and they would go learn the language of radiology. And that's very simplified. I'm sure these technical folks will have better ideas.
I always just want curiosity, I mean, that's all. I mean, especially when you're sitting across from a table from a recent, wherever KU or JCC grad that is design only, and you like their portfolio and you see that they have the talent design-wise, but you're trying to convince them, I know you only know enough HTML maybe to break something, but you don't really know it. So I'm going to try to convince you that you need a job here, and you're going to design and code all day long. And I've successfully done that. And we scare them a little on purpose. I mean, we let them see the language and stuff, but literally their first day, we usually go, okay, you got until noon, play around. And so they play around. Then at 1, Marty, who's my project manager, walks over to him and we'll go, okay, the new issue of Ebony just came in. They need that in 2 days. And they will, wet themselves at that point, because I just started this job and I have to figure this out, and I know the language enough because they let me play around with it before I got here. They always get it done. They don't have, and then at that point we got them on cloud 9 because they're like, oh, I knocked that out. That's awesome. I know what I'm doing now. And so as long as the curiosity is there and they want to learn, going out to, there's amazing resources for any kind of coding, like Treehouse, Code Academy is a really popular one. Those are baseline entry level things where they can go to learn a little bit of HTML or CSS. And just having a little bit of information will go a long ways for us when we're hiring.
I kind of feel like one of the things that could be helpful for a student of the library sciences or liberal arts wanting to get into information sciences, communication is going to be a strong suit, organization. We need, Cerner has a application called semantic search, and essentially what it does is I don't fully understand it, to be honest, but if I understand it, it will, instead of searching diabetes and giving you everything that has the word diabetes, it will instead bring up everything associated with that word. It does not do that magically. Folks had to go in and build I can't even say the word, but ontologies about this word and how it connects, and basically how does language connect to language, and where's the rhetoric. And a software engineer has a background in science, technology, engineering, or math, may not have that background. So we need people that understand rhetoric, that understand language, that understand how to connect those dots. That's the library of the future for everything, not just healthcare. How do I connect my information to context?
Okay. Jeff, did you have anything?
I don't think I have anything to add.
Okay. All right. Hey, I have a question over there.
I have a question. We talk about evolving roles in health IT. I'm Dave Langerfeld. I'm a professor of healthcare information technology here at the college, and I always kind of peruse the job postings, not because I'm looking boss, but to help place my students. And managing data is one thing that I see more and more and more of. And one thing I think is incredibly creative is how some employers and health systems and physician practices have branded the titles of their jobs. So I've seen data analyst, makes sense. Business analyst, kind of makes sense. Data entrepreneur, data steward. I haven't seen data cruise director yet, but I'm sure it's going to come along. I read a statistic the other day that said 75% of information managers still consider Excel their primary method to analyze data. My head about exploded, because about a month ago at the HIMSS conference, I heard a statistic that said Walmart takes in 2.5 petabytes of data every single hour. Any technology people in the room knows Excel can't keep up with that pace. So you guys in industry hiring people, where do you see this role of data steward or data entrepreneur going as we look to place people that are experts in this field?
Well, first of all, I'll just say I don't know why we have to be so creative with titles. I look at about half of our job postings and don't have the faintest clue what we're trying to hire based on what we've called the title. That being said, once you figure out the job that you're actually applying for, I think that, your Walmart example really hits the nail on the head. I mean, there's a huge change from, the physician practice of a decade ago where maybe you were doing some accounting in Excel versus now you're getting literally billions of rows of data daily. And so I think just volume and knowing how to manage that and being comfortable with that is by far the biggest change, at least that I've seen.
Anyone else? Questions? Back here in the back.
John Petit, Echo Select, Staffing and Consulting. I think one of the questions that I have, being in the staffing and consulting business, we pointed out some good things, that there's an incredible need out there for experienced people, especially highly technical people, people that get it. And usually you're looking for somebody that's got experience in a specific area, and it doesn't have to be an area that matches your current job. It's just, it has to be something that's transferable. So I think one of the pertinent questions for being here, at least at Johnson County, is how do we bridge that gap? Because I think we mentioned that in the future there may potentially be one developer for every 3 roles that are open. And okay, so we've got classes that can teach how to be a programmer, developer, or designer, or something like that. And when you come out of school, you're at that entry-level role, and there's lots of places that entry-level developers can get jobs, although right now the market is saturated with people looking for experienced developers so that they can get their projects done as quickly as possible, and then they're taking on some additional students directly out of college and training them. But especially in other technical roles or clinical roles, especially in the healthcare IT space, how do we bridge that gap? What are some of those suggestions to bridge that gap between maybe the hospitals are looking for consultants that have experience with EMR vendors or clinical backgrounds, and then you got students coming out of school that they just can't get in the workforce because it's all entry level. They're entry level, but there's no entry level jobs. So how do we bridge that gap?
We are developing some entry-level type of positions so that people with some level of healthcare exposure, and not always healthcare exposure, but that's generally what we go to. But, I can get a new graduate out of an HIM course and put them on, a service desk type of thing. And at KU, we divide that up so that the providers aren't talking to a technical person. They're talking to somebody that understands the application. So we're trying some of those sorts of things to get people in the door, see if they can start to just work with the end users and the front-end application before we move them along into, the more technical end of the analyst position.
I think another potential opportunity, and we have not done this as much as I would like, but, we've got a huge EMR vendor in the city. We've got many hospitals who have very advanced EMRs in the city. And then we've got colleges and universities that are producing these entry-level folks. It just makes sense to bring some of those people in and do internships or do, some of their academic experiences in, at Cerner, at some of the other vendors, at a hospital or clinic, and get them that experience. Because I think I fortunately don't do hiring and firing, and so I'm comfortable saying this. When a person comes in as a brand new grad and you've never met them before, it's really hard to I think to make that decision to say, okay, we're going to spend the time to train them up and just hope that they're good. Whereas somebody who's got experience, you can call references. It's a rather small industry. We almost all know people at other hospitals and can get real references and things like that. But on the other hand, if you've worked with someone in an internship type position, the type of person they are, how fast they're going to learn, and that kind of thing, much more so than you'll get out of a hour or 2 hour interview. I think in many ways it's similar to, when I was in med school, I didn't just one day apply for jobs and hope to get a residency somewhere. part of medical school is you go out and you do rotations at other schools or other programs where you think you want to go. So they get to know you, you get to know them, you see if it's a good fit. I don't know why we have not, at least we have not done that better. Maybe others are, but I think that's one opportunity.
Yeah, that was knowledge from a hospital hiring situation is nil, but that was one thing, as you guys were talking, that kind of jumped in my head is that I didn't go to school for web. That my background is more front-end development. I was a journalism student. I did that on the side for fun, and then once I realized that the newsroom was dying, I graduated in 2002, and the newsroom wasn't it was kind of starting to become depressing. And I'd spent all 3 years doing internships and thought that was it, but realized that this whole thing out here that was the web was kind of where I wanted to go, but I wasn't going to switch majors in my senior year. And so I kind of refocused classes and stuff and finished with the journalism, but as soon as I graduated, did freelance for myself, and then cut my teeth doing that. So kind of as you're mentioning, not nearly as difficult as a residency, but getting that experience so then I could go get a job and say, yeah, I know my degree says journalism, but look what I've done. And having that speak louder than here's what my background is, schooling.
I have a very good friend that took a similar path.
Yeah.
And I wonder how many other journalist students
Same.
kind of found that same pathway. It'd be interesting. At Cerner, we hire 80% of our folks are coming straight from school or early career. So within the first 0 to 5 years is how we define that. And I work for an organization within Cerner called Catalyst. We work very closely with talent development and careers. We have a Velocity program. We're bringing folks in, whether it be consulting or IT engineering or clinician and healthcare, and we ramp folks on the stuff that we need them to have that they may or may not have. Very similar to high-tech curriculums in consulting and IT and training and system support and system engineering. So Cerner has actually focused on doing this for a very long time. And I think the other kind of key to this equation is partnership with business to academics. And so we have several programs. JCC is a partner of ours. The Academic Education Solution, which is really redundant from a titling perspective, it's an academic EHR for schools of nursing, schools of pharmacies, medical schools, to have their students, provide their students with the opportunity to use an EHR, get an EHR experience in the context of a workflow for patient care if it's nursing, or for assessment if it's physicians. That helps build pipelines. And so we have to work together. And so I think companies are doing this more and more, and Cerner absolutely has created these bridges. And not just with community colleges. I believe we go to K through 12 as well. And we're looking to grow that talent all the way back where interest starts. So folks like Adam kind of have a feel for where they're headed, but also that they don't have to stay in one discipline. Everything we've talked about isn't requiring this one kind of person that knows education. We all need to know so much more than we ever did in the new world and the new workforce. It's not the factory model anymore. And so that requires a holistic approach.
Okay. Well, to build on that question a little bit, because I'm the facilitator, I get to share an opinion. Yeah, I work for HCA. We're a large employer in the area, and I'm sure Truman and KU and the other hospitals in the area deal with risk. And that is the biggest detriment to hiring somebody or even an intern that we have to overcome. And my next question will talk a little bit more about partnerships. But all the expectations so far that I've heard from the community have been expectations or what the employers are going to do to bridge that gap. I think there's opportunities out there for staffing entities as well as students to understand you have to be creative in how you get that foot in the door in a healthcare organization, knowing that we have to have a tolerable level of risk in bringing you in and the resources to train you if you don't know the clinical space, or if you're clinical and don't know the technical space. So as some examples that we have seen over the years, and they're not like a flood of people doing this because it does take some effort, but they've been very successful, is we've had people who have volunteered at our hospitals, have nothing to do with IT, but they've come in, they've learned about the organization, the hospital, how it runs, who the people are, how the organization is, what the expectations are. And those folks that have come in through there and have been very successful in a volunteering way have also been hired because people know them. Also, health IT is a very incestuous industry. If somebody knows somebody at another organization and if they've done well, I mean, they talk to each other all the time. HCA talks to Truman people talk to Cerner people. I mean, it's back and forth all the time. Your best references are the people that you know and are your friends, because you're going to hold them accountable, or you feel comfortable hiring people that you would feel okay holding them accountable, or they'll be accountable to that. So my ask of the industry and the community is not only do the employers need to be thinking out of the box in terms of internships and working with HR departments, but I think the staffing company and the students do as well, to meet us in the middle somewhere. So that's my penny worth of thoughts on that. But it does lead us to the next question, and I'd like for the panelists to feed in, is what collaborations need to happen to better prepare the workforce for entry into the health IT space? Any takers?
I can start with, I guess, a little bit where I left off. I mean, I think that collaborations like our academic EHR that started with business and you know, Cerner and KU had a problem. We needed to educate nurses on technology. KU needed the technology, and quite frankly, Cerner didn't necessarily need the clinical nurses, but our clients did. And we needed our clients to understand how to use software and technology in fruitful ways to improve patient care. And it wasn't about dollars and cents. It wasn't just about improving the economy. There is a patient at the end of this thing. And so understanding that digital environment required us to come together and figure out a way that was affordable, where we could do our part and KU could do their part. Their part was to prepare clinicians for the workforce, and our part was to ensure, in this case, that KU had the technologies that they needed to do that. So they didn't have to find some other way to create a technology that we already had. And so I think that that's anything like that. I don't have the exact science or the model, but get together, have a conversation, solve problems together, build programs. Staffing companies, students, whether it's an internship program or some type of other connection to bridge the gaps that we see.
Yeah, I mean, we hold regular user groups within our community, and those that are outside of the Kansas City area, having them Skype or hang out in, just to ask them their experiences with the language, the platform. We teach classes around the area too, and what we've seen that we love is we get this repetitive group of like 5 or 10 people that, whether we're at KU or Kaufman Labs or our own education, that they're always involved. They're always involved in our community online, and they always come to the classes. And I know they know it already, but they're there because they want a job. And they'll ask, after 2 or 3, are you guys hiring? What's your guys' plan for hiring people? So we get that a lot. And so it is that us reaching out to the community and asking, what can we do better? What do you guys hate? And then the community just being involved because there's a benefit. They know that if they get in and they communicate and there's no immediate perceived value to them, they're just trying to broaden their horizons, going from a social media manager at Cerner to building apps. But there's a payoff for both sides with that.
Yeah, I think, so you use the word incestuous, I'll use the word collaborative. I think both apply. One of the things that I like about what I do is that I think the folks in the community, and I mean the health IT community, not just Kansas City, are a very collaborative bunch. I mean, the regional CMIOs, we meet quarterly and talk about, this is what's going on, these are the issues we're having, how are you guys solving these same problems? I talk to one of the CMIOs in one of the other regional hospitals probably once a week about some issue. And I know that my colleagues, the clinical analysts, are doing that as well. And on the technical side, they're doing that too. I'm sure that you all saw the announcement around the HIMSS conference about a number of EMR vendors coming together on information exchange and sharing. And, whoever would have thought that would have happened. So, I think it is a very collaborative community. There's probably still more to be done, and I think there are opportunities to get involved in a much more structured way. So, regional user groups, for example, I think are a great opportunity to meet some of the employers in the area, and then also some of your potential colleagues to talk about issues and those kinds of things.
Some of the ideas that I've heard float around, partly here at Johnson County, but among the EPIC user groups, ways of collaboration. We've talked about getting a pool of students that can go around to the different hospitals when they have a go live event and help support that. Now, there's all kinds of challenges around the legalities of bringing people into a healthcare organization and, paying them or clearing them or drug screens and all of that. So we still have to work through a lot of those things. But those kinds of collaborations would allow students to get that experience and even maybe in multiple systems, because, Cerner isn't the only application or system installed in town. There's probably 2 or 3 other vendors in town as well. Another thing that, as far as ideas around that collaboration, has been that EPIC clients share their staff across each other, so that if there's a EPIC client in St. Louis, that my staff goes, or a portion of my staff goes and helps support one of their go live events or one of their training events, and then we reciprocate, so that one, we are exposed to each other's workflows and the ways they've implemented their system, and there's just lots of opportunities there. So, and obviously, just events like this with educational organizations, so that we can educate each other and support each other.
Okay. Any questions? Oh, we have one in the back.
I'm Victoria Wangia. I'm formerly with the University of Kansas Medical Center School of Nursing, and I'm starting a new role with the University of Cincinnati as the program director for the Masters in Health Informatics there. So I'm curious, actually this question is for Shawn. I'm really curious about the academic EHR solution you talked about, and I know April Roach very well, and she worked with you on the academic EHR. except I think a lot of the students were undergrad students, and I was just curious if you've done anything with any of the graduate level programs, and specifically with health informatics programs, and how we might jump on the wagon if there's opportunity to do that.
Sure. First, I think that we should have a conversation after this event and go deeper on this. Broadly, we have absolutely been working with nursing graduate programs as well as nurse practitioner programs in PA schools, which are a little different than medical schools. And recently, bioinformatics and I would just say informatics programs, health informatics programs. A lot of them are through the title of bioinformatics or medical informatics, but really, at the end of the day, it's very similar. The biggest challenge to that, we have the technology. Our challenge is data. And when you think about health information exchanges, the health information exchange that I envision, and I think Cerner does to some extent as well, is one that includes research databases and education databases and clinical databases together. So if we can figure out a way to de-identify patient data, and we could do it in a way where everyone is comfortable with the privacy issues that surround that and can trust that that is something that we're taking very seriously, maybe we could use that data for the purposes of research and clinical epidemiology. I think some folks are already doing that a little bit, but how great would it be if we had access to all the data in the universe, right? And could look at that. But education has a huge piece as well. I had a colleague when I was working for Penn State that used to say, my research is my teaching. And that was pretty powerful. So how do you get that data that is being used in the clinical and the research, on the research side of things, clinical research as well as just in the hospital itself, and get it in education? So folks are coming out, we talk about outcomes-based medicine or evidence-based medicine, folks are coming out with the evidence and the outcomes, that's what they're learning. So they already know ahead of time, some of the new best practices. And that just knowledge sharing starts to be even deeper, and the message is getting through. And today, that is still a huge gap for not only education, but also just for research, for a local hospital system that wants to improve their quality. How do I do that? And so if we can figure out how to get access to the data in order to educate on informatics, then absolutely. But that data is the biggest challenge we're seeing today, and the biggest opportunity for us.
Okay. Oh, follow-up question?
So if we're interested in integrating the EHR within our curriculum for the master's program, what approach would we take beyond, and I guess with this particular program, we're looking we partnered with a school of business at the University of Cincinnati, and we're looking to actually train individuals who can go out and be consultants and do some of the work that Kate mentioned around supporting implementation. So it's a little more, it's really hands-on. It's not a research-oriented degree. So to a certain degree, I can see how the EHR could be integrated into the curriculum to introduce some of the students to an electronic health record if they haven't had that exposure. So I wondered if there's opportunity for that at the graduate degree level.
Yeah, so let's definitely talk, and I can give you some more detailed information. What I will say, and what I think is relevant to everyone here, is the word integration in a curriculum. That is key. So, and that doesn't have to be technology. That experience, experiential learning, focus on that, because an experience doesn't just come from a career or a job. It comes from all different sources. And the more we can discreetly capture that data for our students, the better that risk that we were talking about earlier, that starts to go down. We got better reliability, and we can make better hiring decisions, and we also have a better pathway to career as well if we understand where somebody's coming in at a starting point.
Okay. Any other questions? I know we have some students in the audience, so I'm going to put you on the spot. Students of either health informatics or the JCC high-tech program, graduates, could you raise your hands if you're in the audience? Yeah, I see a few. So this is all about workforce. Is any of our students have any questions for the panel members that they would like to present? Oh, it's a shy bunch. Oh, we have one over here.
I'm a respiratory therapist.
Oh, we need to turn on the microphone. I'm sorry.
I'm a respiratory therapist and have been for many years. So I come from the clinical background. And one of the things that I'm really excited about is that I see the information technology as a great tool to leverage to, make my patients better. So the chronic disease management is something that I'm really interested in. What collaboration things are going on in the community in order to use this technology to really impact the baseline health of a great many people.
I'll mention one program that we're doing is an innovation program with the Centers for Medicare and Medicaid Services, so part of the Medicare, Medicaid program. We are working with a variety of sources, or a variety of places that I mentioned earlier. So we're going to homeless shelters, churches, in some cases into patients' homes, and really have a high utilization of technology in the program, both on the patient side. So in some cases, we will be giving patients or churches or other areas actual devices so that they can connect with us more directly. But then also on the provider side. So you mentioned chronic condition management. There are a lot of opportunities to make that better. I think we probably all know that. And putting the key information in front of the providers when they need it is really important. And so we're doing a lot of work along with our partners in the community to figure out when this happens, the provider needs to know, and that kind of thing, so that we're tying in the patient's activities with the information that the provider gets, so that we can help everybody get better.
Okay. All right. I have one final question, and I'm going to modify it slightly from what I have on here, based on everything that we've been talking about with the evolving roles of HIT, or individuals that are working in the healthcare environment with IT backgrounds and clinical backgrounds. What is the one word or phrase that would describe an ideal candidate for a position that you're hiring? And understanding that all these different positions have different responsibilities and may evolve over time, but what is the one key word or phrase that you would describe a good health IT worker as? And
So I'm going to expect to see this on every application we get for the next year or so. So I'm going to say versatile. I think Kay mentioned kind of cross-training and using people in different roles. I think that's a huge requirement. We've all talked about things that the careers that exist now, we probably wouldn't have predicted, a dozen years ago. And so I think if you are expecting to take a job and be in that job for the rest of your life, that number of careers is fairly limited right now. So the ability to be versatile and flexible in what you end up doing I think is critical.
Okay.
I'll throw out a word and a phrase. I'll do both. So I'll use curious because that's what I've already said. That's always the most important thing to me. It keeps everybody on their toes and everybody has fun that way, I think. The one phrase I use a lot, and it excites me when people get it, and especially when we're talking about the app world that did not exist, is saying, it's a gold rush, right? We want to be the people selling the shovels. I don't care about finding the gold. And so we use that phrase, and so I use that phrase a lot when we interview people or when we just meet with prospects, and if they get that, they've been paying attention. You know, they get the bigger picture of what's going on out there.
Passionate. I feel that whether you're, whatever you're doing, understand why you're doing it. Because that's what people get in tune with. You can, know what you do, you might know how you do it, but if you really connect with why you're doing something, that's what other people connect with as well. And that's what's going to bring, if you're in business, that's what's going to enhance relationships. That's going to keep you in business. If you're in education, same thing. Enhance relationships. It's going to get people to be attracted to your curriculum, your school, whatever it is you do. And so hospital, healthcare, same thing. And I think it allows you to, as an employer, retain talent as well if you understand where your passions are as either a company, but so what are you passionate about? And then also, what are your people passionate about? If you know those two things, I think you're in a better position to succeed.
So I tell my staff to question everything, and it just dawned on me that that's more about curiosity, so I have to find a new word. So I would say, I like all these words and phrases too, but I would say engaged. I need you focused, I need you paying attention, and I need you not multitasking.
Great. So one last opportunity before we close. Questions from the audience? Oh, we have one question here.
Mark Pinkerton, I'm a clinician. Quite interesting discussion, and this is a question actually for Adam. What about an app for personal health record? Is that something that's viable?
It can be. I think a lot of those apps, this is a true statement with any app, is it needs to be focused and do its job really, really well. So like just mentioning focus on one thing, not multitasking, that's the goal, that's the mile marker for a great app. That's going to be an app that's going to sell well. The app that I'm helping the class here with is for hemophiliacs, just to kind of track, have a body point and being able to do those things. So there's a lot of, we heard in the speech earlier this morning, there's a lot of medical apps out there. Android, I'd say this, depending on what market you're going to go for, there's different approaches to your app. Android users in general don't like spending money for apps. They'll tolerate ads, but they won't pay money in general. And iOS, they hate ads, and you better not put them in an app that they paid for. And they'll tolerate spending $10 for an app, depending on what it does. There's an app called 1Password, and it just literally, it's a way for you to store all your passwords and have one password, essentially. And I forget what that goes for right now. It's either $9.99 or $19.99. It's a fairly expensive little thing, but it is always in the top 10 or 15 of utilities because it does one thing, it does extremely well, and people accept that price point. So if your idea is on point and you look out in the landscape of things, and think that there's that opening for it, it can do really well. The trick with Apple is the FaceTime, that's a bad word to use for them, but the FaceTime that you get in the iTunes store is pretty much non-existent. The first day your app comes out, you're going to be listed, and then that next day you're buried, unless people buy it and you kind of get yourself pushed up, or Apple features it. Best way to get Apple to feature it is make it look as sexy as you can. They are suckers for design. And so if you can do that and serve, and they also are suckers for just doing one thing really, really well, which is exactly why they've kind of quasi put multitasking in there. I don't think, they're not even really sold on that it needs to be there. But if you can do that, it can happen. And we have people within our community and our clients that get out there on social media and hustle and get people to download the app, get Apple to feature it. I have a personal app that I made, and somebody within Apple likes it. And so around baseball season every year, it gets featured. And so for a week or two, I live high on the hog, and then I go back to selling like 5 a day. But so it's just kind of managing the. Another good resource is apptopia.com. Apptopia.com allows you to sell your app. And so one of my personal apps the other day, not this baseball app, I just threw up there as an experiment to see if somebody's going to give me $1,000 for it, because it would take me a long time to make $1,000 off of it. But what they do is they do revenue projections for apps. So you could go into Apptopia, look for healthcare related apps, and see and they just launched the revenue projection thing 2 days ago. And it's amazing. They give you a lot of theory, but numbers of what they think this app, if you bought this app, this is what it's going to make for you. So, I mean, that'd be a good way to go look and just do some research, too.
Okay, follow-up question?
As a point of clarification, what I was trying to ask was, everybody's got a bank card, and all their information's on that bank card. The problem is you got to have a reader. What happens if you have an app on your phone that has all your personal health information? I mean, it's encrypted, right? Password protected?
Yep.
What if every person had an app? I guess that's more what I was asking.
Okay. Yeah, so then you just get down to the point of security. That's always the tough question with mobile apps. We can build in authentication. We can use a web service that you already have to have an authentication token and say it expires every hour. And there's no multitasking. The second that app closes down, you have to authenticate back into that app and kind of start shutting those layers down. But you can, much like Square. Are you familiar with Square, the little card reader thing? Everybody has no problem handing their credit card over to somebody holding their personal phone, and there's honestly not much stopping somebody from plugging Square in and having it be a let me jack your credit card number from you app. And people are okay with that. And it's hard to either go into like a little bakery or go to swap meet or the river market and not see people using that to buy produce. So I can't imagine, it's a barrier. People are going to be scared at first with it that, I don't like the idea that it's all sitting here. You can learn a lot about my daily habits from this thing. So, and once people kind of get over that, and once I plug it in, it goes out to their cloud and it stores Adam's stuff all out there. So if somebody wants, they could get to I'm not going to be really thrilling, but they could get to my personal data and how much I walk and where those locations are. Like, okay, well, he's at 16th and Main for 8 hours a day, sitting, not moving. And then at lunch, he walks a half a mile to the grocery store and a half mile back. And they could see those things. It's just getting people past that perception that that's scary. Maybe it is scary, but I'm over it, so.
Okay, well, Kay, Jeff, Adam, and Shawn, thank you very much from the bottom of our heart for the time that you spent here today. It's very, very productive and great information that you're providing. As a token of our appreciation, we have some gift cards for you, so don't let me forget to give these to you. But from the audience, if we could please, a round of applause for your appreciation for their time today. And next up, we have Deb Elder with our high-tech program. And if anybody knows Deb, she is a tireless worker and definitely somebody who put the most effort in putting this program together, organizing it, the collaboration between private industry, the businesses, the healthcare organizations, the educational organizations, and the speakers that we have here today. Before we even bring her up here, I do truly think she deserves a second round of applause for all the effort she's done today. Thank you. Thank you.
Okay, let me get set here. I know I'm between you and lunch, so believe me, it's not going to be very long. I just have a great opportunity here to share with what some of you have asked. What is your program? I've heard a lot about it. I know you have something going on at Johnson County. So what is it? Well, let me share a little bit of my passion about health information technology through our program here at Johnson County, which is Health Information Systems is what we call our program. And you'll not only hear later today a little bit more about workforce and that there is a tremendous need, which you haven't maybe already heard this morning. Statistics just come out like crazy supporting that fact daily. So we have national surveys. We have all kinds of results that are showing this, that there's definitely a need. But are we at a tipping point? Are we there yet? Do we have the workforce? The title, part of the title of the event for today in the summit dealt with, are we ready? Do we have that workforce? Yes, the workforce is out there. There is a need. So what are we doing about it? Where are they? We see that, and they even visited with that point about that this morning, they are actually stealing from each other, it sounds like. So how do we get to the next level and get that talent pool trained up so they don't have to do that as much? But again, you hear that they want them that are trained. Well, a couple of years ago, through the Recovery Act and HITAC, we became part of the Midwest Consortium of community colleges that were training the students, and this started the fall of 2010. Since then, as of last June, we graduated 116 students. And we have many more started last fall that'll be graduating this spring. From that, the Department of Labor also saw that there's a tremendous need, and it was through the H-1B grants that came out that we came on board with to say that we can now help implement the program a little bit further, expand it a little bit further, and help the national workforce. Unique training needs. What are those unique training needs? Well, this is what we've been struggling with over the last couple of years. There's so many different needs. Yes, you need the healthcare. Yes, you need the IT pieces in the health IT industry. How do you train everybody on everything? You really can't train on everything. It takes a lot of experience. It takes a lot of exposure. It takes a ton of engagement from the industry, and we've been very, very blessed with our partners in that area. And they want quick, high-level training. The training must be flexible, and they want the new workforce to be experienced in specific software applications. If you see the postings out there, they usually say, and they have experience in X solutions, applications. So students right off the bat will go, well, I don't have that specific one, or I don't have that. What do we do? Where do we go from there? We advise them to go ahead and go for that opportunity to share and talk to them anyway, the employers, because now that tipping point is getting a little bit closer. Part of the Department of Labor grants that we're working with, Of course, it's to train the workforce with updated job skills and new skills in this area, which change all the time. And the second one is talking about career training programs. One of those goals we're solving today. We have gathered you together as stakeholders in developing this statewide network. And the other piece is developing the career pathway for four-year colleges, and we've started those conversations. It's very rare to find any bachelor's program, let alone master's, in health IT. There are many variations of that. So we need to have those discussions. How can we help those students move from associate's degrees to, we have the certificate program, and on into the degree of bachelor's and master's degrees. Our specific program has 2 certificates. Now, just as daunting are the titles and positions today that are available as we have named our titles of our certificates. You'll see one is Health Information Management Redesign Specialist. The new one also includes Trainer. The second one is Health Information System Specialist that also includes Implementation. So these were not randomly selected. These were 4 of the 6 roles developed by the Office of the National Coordinator for Health IT. And within that national curriculum that we also provide, we have developed this into 2 semesters. You can receive this training in 2 semesters. We also see that there's a need for employers wanting customized training, and we provide that. It's one of the few programs that, yes, it's accredited by the Kansas Board of Regents, but we can customize that for the employer. Maybe you only need staff trained in certain areas of quality improvement, many other areas, and we can do that for you because we have the option of using our continuing ed side, so that's very exciting. They also have it supported by the National HIT Pro exam, and the stackable credentials can be anything that's related to either healthcare or IT. What we're trying to do is to prepare the workforce to be marketable, someone that you need, someone that you can use. We also provide HL7 certification prep. We actually have one coming up in a couple of weeks, and we have a few spots left if anyone is looking to work with getting their HL7 prep ready. Our students are experienced healthcare IT professionals. They want to transition, they're second career folks, but they're also degree-seeking healthcare IT students, and they want to specialize. Can you imagine if you come out with an information systems degree and you have a certificate specialized in health IT, what that does to put you ahead of other students that have the general IT or IS, or even if you are a nurse coming out of an LPN program and you have some of the IT support classes, understanding what's going on in information exchange, understanding the software and what it's about and how the databases are aligned. Again, you're going to be worlds ahead of others that are in the general programs. Okay, I think I have kind of discussed this. One thing, in addition to, you can have core components. You can have curriculum that is set in stone. I want to tell you that we don't have any textbooks. We only have one in terminology because usually healthcare terminology is not going to change that much, although we are creating our own as well. All the rest of our curriculum is developed and online in our learning management system because we know we have to change it at least weekly, if not daily, to keep up with the industry. And to do that, we have to have industry experts as faculty and as adjuncts. So we're really happy to have Dave, who's been in the health IT with an information systems as faculty member, and Diana, who's been in healthcare as a nurse forever. So the 2 combined full-time faculty member are the strength as far as hiring our adjuncts, who are daily CIOs of hospitals, who are quality improvement of local hospitals, folks that know their stuff. You can be assured that students come out and know what's going on. We have the EHR implementation experience as well. Students not only get the front-end experience, but they get the back-end experience if that's the certificate that they took. I alluded earlier to our advisory board. You can see who those folks are that are on our advisory board. These folks have stuck with me now for about 2 years, and I really appreciate that. They review our curriculum for us. They give us feedback on what the next steps should be, maybe what a stackable is, They see something that we can now offer in the continuing ed side. Maybe we need to be addressing it in a different way. We can certainly change it up. We have different avenues of delivery, a hybrid, which is 1 night a week. We have fully online. We have video conferencing available so we can reach out to any organization, healthcare system. Their staff can't get away, but we need to work with them in some way. So we have versatility in delivery method as well. These should be familiar topics for you that are also very important in today's language in healthcare. These are things that are at the forefront of what we provide in the program. We talked about bridging the gap earlier. We do have paid internships available. So if you're an employer and you say, I just don't have enough dollars to invest in onboarding for a short amount of time for an internship, I can help you. I have dollars for you. But you know what's really important here is that gap they were talking about earlier. The students have the opportunity to get inside the culture, even if it's for a few weeks. But you as an employer have a unique opportunity to engage with students and to kind of test them out to fill that workforce need. But that's up to you. So I see the next steps in what we're doing as improving our education training. Education itself, as institutions, we have to train, change in how we train and how we teach and be more responsive, be able to turn training around quicker. That's my challenge. That's what I want to do and be able to provide. We need to provide the healthcare IT pathway to make it flexible, many, many, many different specialties. And then we need to decrease the gap between training and employment. I want to share the resources with you. These are the groups, a short list. We have a longer list, but this is a short list that we share with our students. The reason being, HIMSS has been an integral part of getting on top of the information necessary for our students. We highly encourage them to become members at only $30 for a year. You get tons of information coming to you and all kinds of career information that's available. As well as going to the healthit.gov to know exactly what's going on with the Office of National Coordinator. If you want to make yourself marketable, you need to know what's going on. So we highly advise, and we have many of our students, I believe there's probably 40 at least, or 50 now that are members of the local chapter, if not national. So we also encourage other pockets of educational institutions to encourage your students as well. Would love to be able to build, because my other role is chair here in the HIMSS chapter for education and workforce. We want to expand that opportunity to engage other students and other programs of learning so that we can better train and educate the population of current information and health IT in this metro area and across the state and across the region. Last thing is, why are we doing all this? We're training to improve the quality, efficiency, and security of healthcare. And that's my job and role, is to help guide our team, and what an excellent team we have, expanding out to not only our advisory board and our staff members, but across the campus who supports us, and across the HIMSS board that supports us. And I see this growing as I see new and wonderful faces here with us today. So that's it in a nutshell for what we do here.